tell you everything that I think you should know about how we came to where we are in what we call restorative surgery rather than reconstructive. So why do we really need a face? Why do we need to have a set of eyes, nose, and mouth? Well, we sort of take for granted that you can every morning get up and brush your teeth and eat breakfast without drooling. You can speak and people understand. People can recognize who you are and you're anonymous in the crowd. All these things that happen regularly, our patients with major facial deformities lose. In addition, very often it takes just a glimpse to understand what's the person's mood, what's their current mind thinking, whether they're happy or angry, whether these presidents have good moment or not so good moment, and so forth. And it really, for your brain, it takes the configuration of the eyes, nose, and mouth to even consider a face human. Otherwise, the brain just can't process it. So if there is such a devastating injury, like many of our patients have, how do you really reconstruct the face? The face is remarkably anatomically complex. You have mucosal lining that has very specific shape and specific dimensions. You have several layers of muscles. This is just a deep layer of the buccinator and orbicularis, so that you can open and close your mouth and control your lips. You have glands. You have blood supply that has to keep all the functional units alive and bring nutrients. And you have variable thickness of skin, from the thinnest skin that exists on the human body, like eyelids, to some of the regular thickness skin. So there's a huge variability and variation. And all of these structures really work in very, very tight concert, so that you can actually perform functions of the face that you have. But beyond what we have just talked, you also have major senses on your head. So you need eyelids to protect your eyesight. You need nose to be able to smell and breathe. You need tongue to be able to speak and sense the taste of the food. And of course, hearing is slightly remote from the actual facial area, but pretty much touch is important as well. So many of these senses have to be protected and are protected by the face. It appeared to me that tissue engineering was so far away from patients. Not even the simplest tissues and engineered constructs can get to the patient so far. And there are a lot of challenges that tissue engineering as a field faces. So I figured that probably the only way I could really restore the face would be by transplantation, a technology that was relatively imminently available and just required certain things to put in place. So my thought was that perhaps I could take some of the principles that we have learned about immunology. We have known that skin is the most antigenic or immunogenic tissue, so it causes the most severe rejection of all tissues that you can transplant. And that's why it's been very much feared for transplantation, but there also have been precedents of transplanted limbs several years before I started on staff that showed that the proof of principle was there. You could actually do it. The patients can be managed and the rejection can be handled as well.